We have really good data that give us a pretty nice national view of how antibiotics are prescribed in outpatient settings. We know that about 835 prescriptions per 1,000 people are prescribed each year in the United States, just in outpatient settings. That equates to about and really is enough antibiotic prescribing for every 5 out of 6 people to receive an antibiotic each year. I also put this number out there. It's about 266 million antibiotic prescriptions just in that setting. When we think about hospitals, we know that in hospitals that about pretty much 50% of patients who are hospitalized will receive at least one antibiotic during their course of stay. So not only are we seeing a lot of antibiotic use in the outpatient setting, in doctors' offices, emergency rooms, we're also seeing a lot of antibiotic prescribing in hospitals. So we recently published a study where we looked at the number of prescriptions and both the proportion of prescriptions that were unnecessary in doctors' offices and emergency rooms, and we found that at least 30% of all antibiotics prescribed in these settings are completely unnecessary, which is a pretty alarming number. And that actually equated to, in that particular study, 47 million prescriptions per year. We know that in addition to unnecessary prescribing, that there is a lot of issue related to appropriate selection of antibiotics and also making sure that the patient also gets the right duration and right dose of antibiotic. Another recent study that we published related to outpatient antibiotic prescribing showed that about 52% of patients get the first-line agent for 3 common respiratory infections like ear infection, sinusitis, and pharyngitis. And we think that number should be closer to at least 80%. So we know that there's a lot of opportunity to improve how we're using antibiotics in that setting. In hospitals, we know that there's a lot of opportunity to both improve how we're selecting antibiotics. When patients get started on antibiotics, they're often treated empirically before we know what's causing the infection or before we know whether or not the patient has an infection. And so there's often an opportunity to stop the antibiotics within 48 to 72 hours or to change to a better antibiotic. In terms of what the implications are if a patient receives an antibiotic when they're not necessary, it's really important to know that there are a potential for adverse events associated with antibiotics. Adverse events can range from minor side effects like rash and sometimes diarrhea, but they can actually be much more severe. Anaphylaxis, and what we talk about a lot now is the problem of Clostridium difficile, which is a potentially deadly diarrhea, and the biggest risk factor for that infection is being exposed to an antibiotic.